Hi guys, now tell me, have you ever looked at a rhythm strip or a telestrip and seen a wide, bizarre complex staring back at you? Well, hyperkalemia might be the culprit. Let's break it down very fast here. What hyperkalemia is all about, okay? So basically, hyperkalemia is when your serum potassium level is above 5 milliequivalent per liter. What could be some of the causes? Now, memory trick, let's make it the 3 R's, okay? So one is renal failure. That means your kidney cannot excrete the potassium. Two, release from cell problem. So we have conditions such as rhabdomyolysis, where the skeletal muscle injury causes the release of damaged proteins, myoglobins, into your bloodstream and causes kidney failure, okay? And then we also have the hemolysis and we also have acidosis. And thirdly, we have retention from medication, such as your ACE inhibitors, your ARBs, and also your potassium sparing diuretics like your spironolactones. Okay, so this is the main causes of hyperkalemia. Now, what are some of the clinical presentations of hyperkalemia? What would the patient be telling you? Okay, so normally patient will start complaining of muscle weakness, fatigue, like numbness, or even paralysis. Okay, because potassium dysregulates the resting membrane potential, and so making the cells less excitable. Okay, but the real danger is cardiac. So as your potassium climbs, your heart becomes increasingly irritable. So you need to watch out for palpitations, you need to watch out for bradycardia, and in severe cases, ventricular fibrillation and cardiac arrest. Okay, so you need to always watch for that. Okay, so this is the sequence you must know. First, it starts subtly. There's peak T waves. Then the P waves disappear. Then there's a QRS complex widens. The QRS is usually 0.12 seconds or your small 3 boxes. Okay, but in hyperkalemia, it widens. So eventually, what happens? There's a sine wave pattern happening. Then, guess what? Code is waiting to happen, right? So you need to always watch your EKG strips very well and monitor your patient very well, especially patients on like patient having vomiting, on NGs, anything that deals with that will lead to electrolytes being lost. You need to watch out for them. Okay, now let's look at the treatment for hyperkalemia. Let's make it simple. Mnemonic, C, big K. So the alphabet C and the word big, B-I-G, then K. So C, big K. Now, let's follow this pattern. C is calcium gluconate. So the doctors will usually order for calcium gluconate IV. And what does it do? It basically stabilizes the cardiac membrane, or it glues the heart muscles together. So that is going to be your first line of action when there's changes in your EKG. And this usually will help buy you some time. Then your B is bicarbonate. And what does it do? It shifts your potassium into your cells in patients who are acidic or acidotic patient. So if you are talking about that acidotic patient, if you haven't watched my ABG explanation, please do, and you understand that. And then your I is insulin and glucose. And this is mainly the reliable way where it shifts the potassium into the cells. Then we have GI elimination, where you have the K-exhalate that binds with intestinal tract and then gets excreted. Then we have kidney excretions. So we have dialysis if the kidney is not working, and then we have loop diuretics for patients who their kidney is working. So remember this, calcium doesn't lower potassium. Note this, calcium doesn't lower potassium. It actually protects the heart while you work, or while the heart work. Okay, think of it like this. A house with a faulty wire. Potassium is the electricity. When potassium is too high, the wiring becomes unstable. So the heart can suddenly cause a short circuit or arrhythmia. So remember, the calcium doesn't fix the problem, but it basically stabilizes the wiring. Or in simple terms, it basically puts a temporary shield around the electrical system so your house doesn't burn while you fix the potassium. Okay? Then the insulin will come in and shift intracellularly. And then if the kidneys are out of the picture, then remember your dialysis is going to be definitive. So guys, know your ECG changes, know your three main causes, the big 3 R's, and know your treatments, the mnemonic C big K. When you do that, you will be able to catch hyperkalemia before the patient codes. Okay?